And I appreciate his leadership, not only for this hospital, not only for this region, but for what he and this hospital system are accomplishing across the entire state of Texas. But more important than all of those people, thank you to all of the doctors and nurses and to all of the staff who work at Houston Methodist for what they've been able to accomplish as a team. Before you all came in here, we did have a very productive conversation about things like the COVID response and about things like the way the vaccination program is working. We also discussed some lessons learned from COVID to build a healthier Texas as we move forward through the course of this pandemic and, importantly, after the pandemic. And those conversations included issues such as ensuring that we are going to have the capability of maintaining ongoing supply chain availability for PPE in the future, not being caught in the future like we were in the past with having inadequate PPE. We talked about the value that we have come to appreciate by accessing and using telehealth. And we want to continue to expand the use of telehealth as we move forward, both during the course of the pandemic and after the pandemic. Another thing that we need to do as a state, and I know is a big issue here in Houston and in this medical center, and that is to help our fellow Texans deal with the challenges of their mental health needs. There are unique mental health needs as a consequence of the pandemic, but even before and after the pandemic, there are mental health needs that the state of Texas needs to work collaboratively with their medical professionals to make sure that we step up and fully address those mental health needs. Now, I'm proud to say that Houston Methodist is one of Texas's mass vaccination hubs. Their exceptional work has led to their ability to be able to administer more than 4,000 vaccines in a single day at a single location. Houston Methodist has helped Texas become a national model for the vaccination program. Never before in the history of our state have we been able to vaccinate so many people in such a short period of time. And it's remarkable when you think about it, because everybody's talking about are vaccinations, but the fact of the matter is we've been involved in COVID vaccinations for less than 5 full weeks at this time. In that time period, however, we've seen remarkable results, and here I'm getting into the numbers. As of yesterday, make that as of today, the state has distributed 1,725,575 doses that have been shipped to providers. 1,358,678 of those doses have already been administered to Texans. 177,193 of those are second doses. Percentage-wise, Texas has administered 81% of first doses, 67% of second doses. Overall, 78% of all doses allocated to the state have already been administered. Separately, and in addition to those numbers, Texas has provided 487,500 doses for nursing homes and long-term care centers. CVS and Walgreens are in charge of administering those doses. They have administered 124,827 of those doses to those who reside in nursing homes or long-term care centers. We as a state continue to insist that Walgreens and CVS pick up their pace, because while Texas is now administering 78% of vaccines, Walgreens and CVS are only at 26% of their vaccine administrations. Now, one way that Texas has been able to tremendously accelerate vaccinations is by opening up these large-scale hub vaccine centers like what Houston Methodist has been able to accomplish. What this does is that it allows communities to have several locations capable of vaccinating thousands of people at each of those locations. Last week, in Texas, we had 28 large-scale hub vaccine centers like what they have at Houston Methodist. That number dramatically since last week. This week, we now have 78 large-scale hub vaccination centers. Altogether, there will be, this week, 260 providers in 122 counties getting allocations this week. Plus, there will be providers in other counties still vaccinating with shipments that they had previously received. Residents of all 254 counties in Texas have been vaccinated. Importantly, localized here, Harris County has administered far more vaccines than any other county in Texas. The number I have, I think this is as of yesterday, Harris County had administered 259,848 vaccines. To give you a comparison, Harris County has administered almost double the amount of vaccines by the second closest county, which would be Dallas County. The number one vaccine administrator provider in Texas is Houston Methodist, which is a key reason why we wanted to be here today to say thank you for your leadership in being the example for how swiftly this can be done and being a model for other providers across the entire state of Texas. As Dr. Boone knows, as everyone knows, because of our scaled up capabilities of quickly providing these vaccinations, there's only one limitation that we have at this moment in time, and that is an inadequate supply of vaccinations. And that supply of vaccinations comes only from the federal government. Now, we do get new supplies each and every week. I want to give you the numbers for this week. This week, we are slated to receive our largest supply of vaccines to date. We are receiving this week 333,650 first doses, 509,400 second doses, for a total of more than 843,000 doses this week. And that does not count the number of doses that will be administered in those long-term care facilities. We do expect to see ongoing increases in the number of doses that will be available to us, but again, that depends upon the federal government. Very importantly along those lines, on Sunday, Dr. Fauci said that we should be weeks, not months away from getting additional vaccines. He talked about the oncoming probability of soon receiving vaccines from two new providers. One is Johnson & Johnson, and the other is AstraZeneca. Receiving those additional vaccines would massively increase the supplies that we have in Houston and across the entire state of Texas, and being able to vaccinate far more people far more rapidly. Now, another thing that we talked about is that in addition to vaccines, Houston Methodist is also using antibody therapeutic drugs to reduce hospitalizations. In fact, here again, Houston Methodist is the statewide leader in the amount of antibody therapeutic drugs that are being administered. And so we have private, what I call private providers like Houston Methodist, as well as other hospitals and other healthcare centers across the state. But in addition to that, the state of Texas is operating 12 antibody therapeutic drug administration centers across the state. These drugs are very important to help Texans who contract COVID stay out of hospitals. We've heard information here today about the effective results seen from the administration of these antibody therapeutics about achieving that goal of keeping people out of hospitals. Bottom line is that with these strategies, as well as with the outstanding work from the frontline healthcare workers that we see at places like Houston Methodist, Texas will remain a national leader in COVID response, and together we will work to achieve a healthier Texas. With that, I will pass it first to the Chief of the Texas Division of Emergency Management, Chief Nim Kidd.
Thank you, Governor. And Dr. Boone, I really want to thank you and your team, the men and women of Houston Methodist. Your confident, competent leadership, your ability to be flexible in times of uncertainty are the hallmark of all this success. I've always seen you and your organization put the patient first, trying to do the right thing, and I'm very grateful for that. This is why you're leading the state. We're very much appreciative for all of your efforts and work. I don't think there's been a 24-hour period that's gone by that you and I haven't been in contact with each other some way. So sure. I know you're a tireless advocate for taking care of Texans. Thank you for that. You know, in all of our businesses, all of ours, the quest for efficiency has been the killer of preparedness. It's what keeps you driving around with a quarter tank of gas in your gas tank at hurricane season. It's what keeps very few supplies on our shelves whenever we're making a run on the market. And it's what's caused all of us to have PPE shortages. So our agency will continue to source and secure PPE for all first responders and healthcare workers. We'll continue to work on testing materials and supplies. Testing is still a very important strategy in this fight against COVID-19. Even though we have the antibodies that are out there, which have been life-saving, and the vaccines, we still need to continue our testing protocols. We'll continue to support our staffing. And, you know, we're not out of the shit, Governor. We're in a great place, and we're moving forward. But we have to keep doing the things that we have been doing until we can turn the corner on this. So thank you all for your efforts.
Very good. Now, Dr. Hellerstedt, the Commissioner for the Department of State Health Services.
Thank you, Governor Abbott. And thank you, Dr. Boone, for having us here and getting to meet your team. We had an incredible discussion prior to this news conference. I heard some amazing things. I heard about how an organization that's well-led and extremely well-organized, but has the compassion and has the spirit and the intention to help its community on a large-scale basis. You know, for folks who aren't really familiar with how healthcare is delivered, they might say to themselves, well, of course hospitals can stand up mass vaccination centers, right? Isn't that what they do every day? No, that's not what they do every day. But you see here an example of the kind of initiative and forward thinking that an organization can engage in when it truly has a commitment to the best benefit of the people of its community. And they're not alone. There are other, they work with other hospitals. There are other parts of the state where similar types of collaborations have taken place. That's why we're doing so well. It really is the Texas spirit. It's the spirit of getting together locally and solving problems and getting this solution out to folks. We are very excited about vaccine. We're very excited about the prospect that there'll be more vaccine. As some people have said, it's the first time against COVID-19 so that we can ultimately have a victory. But don't forget, in a battle like this, just because you've gone on the offensive doesn't mean you can ignore defense. You still have to defend yourselves, and that's why everyone in this room who's not speaking is wearing a mask. We need to continue to engage in those infection prevention and control behaviors until we have really finally driven COVID-19 into something in history, and we can get on with the way of life that we prefer. Thank you.
Doctor.
Thank you. Well, good afternoon, everybody. I'm Dr. Mark Boone, the President and Chief Executive Officer of Houston Methodist. And Governor Abbott, it's been such a pleasure this morning and now into this afternoon hosting you and your team here with our team of frontline workers here who have made such a difference in this pandemic. Dr. Hellerstedt, Nim Kidd, Dr. Zerwas, so deeply appreciate each of you being here as well. You know, it hasn't been the circumstance I would have wanted, but I've gotten to know the governor and his team pretty well this year, and let me tell you, they've been great to work with. And Governor, I'd like to thank you for your response throughout, whether it was early on getting us PPE, helping us with staffing through the first surge, and now, of course, all the hard work on convalescent plasma and on vaccines. Really deeply appreciate it. In that time, I've been so impressed with your commitment and, you know, what you talked about, really making sure we make things happen as a state and moving things forward. Got to tell you, you have a great team. Nim joked about it, but I mean, I literally email, text, phone call all of these individuals, among others. Imelda Garcia has been great as well on a routine basis, and they are so responsive day and night, always with that can-do attitude of how do we help the citizens of Texas and make healthcare better. You've also been instrumental in working on monoclonal antibodies, and very proud to announce today we will hit our 2,000th infusion of a monoclonal antibody to patients here across Texas, and we are convinced those are making a real difference in keeping people out of the hospital. You've also helped, as you talked about at length, with the vaccination process. We have now hit 60,000 first individuals across Houston Methodist for a first vaccine, another 17,000. So all in all, we've vaccinated 77,000 people. And I can speak with my colleagues across the Texas Medical Center and say we're now up to about 141,000 patients together that have received at least one dose of vaccine. Great collaboration among the city, the county, the TMC hospitals in doing all of that. Just at Houston Methodist, we have vaccinated people from 712 zip codes across the state. So we're making a real difference across the state. As you said, the rate-limiting factor, as I work with the city, the county, other hospitals, is supply. When the supply is here, I am confident, working with all of them, working with our pharmacy colleagues, that we will move things forward greatly. None of this would be possible without your strong leadership. And I have to say, I chair a couple meetings with CEOs across the country, and they're envious of the crisp decision-making, the responsiveness, the flexibility, the focus on execution that's been the hallmark of working with your team. And it's little wonder, I think, that we lead the country as a state. So thank you again, Governor Abbott. And then I want to just wrap up and acknowledge that hospitals really across our state, they've put in one heck of a year, almost a year now, and this wouldn't be possible without the brave men and women, heroic people really across Houston Methodist, across all the Texas Medical Center hospitals, and across hundreds and thousands of people across our state. They're dealing with the highest surges we've seen. They're dealing with convalescent plasma, with vaccination drives, et cetera, and they're answering their calling to healthcare, and we're so proud of each and every one of them for what they do. And then finally, I'd like to just remind everybody, and we heard some of this already, we all need to continue to focus on what we know works while we wait for vaccines to kick in. So we need to be wearing a mask. We need to physically distance. We need to avoid social situations where we let our guard down. And very importantly, everyone needs to run towards this vaccine and get this vaccine when it is their turn. Our physicians, our scientists, others have studied this at length. These vaccines are safe, they are effective, and we stand behind them and will continue to drive that. So thank you, Governor, and thank you to your team.
Thank you, Doctor. Also, I do want to recognize that we are joined today by State Senator Boris Miles. We are not only in his district, but also Senator Miles is a very important senator in the state legislature as it concerns healthcare-based issues, and he will be working with us as we continue to address these issues in the coming session. With that, we'll be happy to take a few questions. Yes.
Governor,
Go ahead.
Governor, can you talk to us about why we are in the largest county in the state, fourth largest city in the country? The mayor and the judge are not here today. They spoke publicly about how they have really put forth a portion of the mass distribution of vaccines, so they would like a chance to talk to you and try to get those vaccines distributed properly. They also point out that last week when we visited a different county, up in Tarrant County, that the mayor and judges in those communities were included.
Yeah, for the rollout that we had the last week, the purpose of that rollout was to show the public what one of those centers looks like. The purpose today is different. The purpose today is to recognize not one of the leaders, but the leader in the state of Texas with regard to vaccines, with regard to antibody therapeutic drugs, and to use them as the example to talk to others. We spend multiple days every single week talking to the local officials, whether it be the local public health officials or the local officials themselves. Maybe not a day goes by. If it does, it's only one day that goes by without either Chief Kidd or somebody who works for Chief Kidd or Dr. Hellerstedt or somebody who works for Dr. Hellerstedt in constant communication with those local officials, and that process will continue. But today is a day that we celebrate and highlight the role that Houston Methodist has played, and we urge others to copy the example that Houston Methodist has set.
Governor Abbott, Don Dodd from the Examiner of Beaumont, Texas. We've met a number of times when you were down with our various disasters. And on December 3rd, you appointed Mayor Becky Ames as, you commissioned her on the disaster task force affecting elderly and disabled persons. And she has set up our Civic Center which is capable of vaccinating over 1,000 people every day. They're sitting there today empty, and they've only received 100 doses at the Beaumont Health Department. Would you commit today, sir, to looking into that and seeing what you can do to get, we have a facility, we have the people. As a matter of fact, the financing has already been provided by the state. I believe they received a $67,000 grant to administer vaccines, but we've only had 100.
Sure.
Would you commit to that for us, sir?
Well, I think if you wait momentarily, you're going to get an update.
So, Nim Kidd, the Division of Emergency Management, and actually a little misleading in the question. While that facility may have only received 100, Jefferson County's had over 14,000 doses to push there over the 5.5 to now 6-week period. We will continue to work with the hub providers, and Mayor Ames is a great supporter and great leader in this focus. We will commit to continuing to push the appropriate per capita amounts of vaccine across the state that we received. And as you've heard the governor say, those don't come to the state. I think that's a little bit of a misconception. They're not shipped to Texas and then we redistribute them out. Those go straight from the manufacturer to those facilities that, one, have the capability to receive and accept the vaccine, and then two, the ability to administer it like we've been talking about. So once that center is up and running, we hope that those other agencies in the area will work together, because we see mass vaccination centers as the most efficient way to deliver. We'll continue to work with Mayor Ames and her team in order to use the most resources that they have.
2 more questions.
Governor, Phil Archer, Channel 2. Are there any plans to make distribution more equitable? Regardless of Houston Methodist success with distributing the vaccine, we're getting calls every day from people who are eligible but can't find it. And we're also noticing that a number of large hospital chains that have been given supplies of the vaccine are limiting it to people or patients already in their system. Should they be allowed to do that? Shouldn't that be changed?
So I'm going to answer your question, but while you were asking it, I was getting a big head nod no by Dr. Boom. Let me have him answer first. And when you provide your answer, I'm not sure what you were going to say, but if you would share with them what you were telling us earlier.
Certainly.
About the equitable distribution that you have achieved.
Certainly.
And then I'll come back and add more. But Dr. Boom has some specific details that respond to your question.
Yeah, those equity issues are critically important to us. I mean, as a hospital system, we face social determinants of health and the barriers they provide to good health care every single day. So we've been very intentional about how we cover the population very equitably. So let me walk through how things have happened over the last month. First, we were given the authority to vaccinate 1A individuals. So that was all of our individuals internally working with our physician offices, their staff, and very quickly vaccinated probably 13,000 plus 1A individuals outside of Houston Methodist. So those are fire departments, ambulance, home health agencies, physician office staff, et cetera, throughout our community. Between Christmas and New Year's, we got the green light, which was something we were very pleased from the state, to start vaccinating some patients in 1B. The quick, expedient way to do that was to start inviting some 75-year-old plus in our databases. And keep in mind, our databases have the sickest people in them, so we were able to prioritize the people who will benefit most from vaccine. Subsequent to that, we have rolled that out so it's both our patient base and a sign-up process for the community. The challenge, as we've been talking about, is there's not enough vaccines. So give you an example. We opened up a link. In about 8 hours, we had 20,000 requests to be vaccinated, in addition to other databases and other sources we have. And that obviously is way more supply than we're getting right now. What we did very intentionally is we are looking zip code by zip code. We work with the UT School of Public Health. We've identified zip codes that are more socially vulnerable with lower socioeconomic status, high levels that are below the federal poverty line, zip codes that are high affected by COVID, and look at some of those areas and essentially almost double invite into those areas to try to drive vaccine uptake in those hard-hit areas as quickly as we possibly can. We've also worked with federally qualified health centers, Vecino, El Centro de Corazon, Legacy, Hope Clinic, and many others in the future. I know our colleagues across the Texas Medical Center are doing the same. The fundamental issue right now, as we've all talked about, is there's not yet enough vaccine to get to every 75-year-old or every 65-year-old, so we're working very hard to do that as equitably as we possibly can. As I mentioned a little earlier, we've covered 712 zip codes that have had a person receiving vaccines. So this is a very wide and far distribution that we're doing.
No,
And, go ahead.
I'm sorry.
I was just going to add, in your question, you mentioned hospitals. The fact of the matter is, in many, maybe most locations across the state of Texas, is the local public health authority that's leading these mass vaccination sites, making sure that it is done in as equitable fashion as possible, but working to achieve the goal that was set out by General Perna when he, a week before we received the vaccines, set out the standard that we were expected to achieve. And that is one thing, and that is to save lives. And that's exactly why we identified the population base that we have identified to be the first to receive the vaccines. And because if you just look at the math of it, the people who are most likely to lose their lives because of COVID are either those who are age 65 and older, or those under the age of 65 who have other chronic healthcare conditions that would make them susceptible to losing their life because of COVID. And I can tell you for a fact that in region after region across the entire state of Texas, whether they are local public health authorities or hospitals or other healthcare providers, they are keenly focused on achieving that common goal, and that is to do as much as possible to save lives.
If I may redirect to the doctor.
Dr. Boone,
Doctor,
Dr. Boone, Houston Methodist has a footprint internationally, and your database also has patients who have visited your facility from other countries. What measures are in place, or are there any measures, to prevent anyone who is in your database who is from another country to not receive a vaccination, or have you invited people from other countries, neighboring nations, and have they received the vaccine?
To my knowledge, we've not done that. We've been focusing on inviting people that are in our database. We're able to look at age. We're also able to then look at obviously many other risk factors, and so we can identify the people who will most benefit in terms of turning down the terrible death rate, turning down the terrible outcomes of this, and then again, we are doing that broadly across our community. So we have vaccinated, as I said, across the state of Texas, but it's really been focused on people who are coming to us from across the state of Texas. Of course, oftentimes I think I see a zip code. For example, in Austin, most likely that's somebody who's living with family here that's getting care here in our community. I'm very confident that we've got a very fair process and an equitable process, and we'll keep driving forward as fast as we possibly can, but we need to continue to get more vaccine.
Is there any preventative measure, Governor, for anybody from outside the state of Texas who might be within a hospital database as a past patient to be invited and get the vaccine?
It's clear that the vaccines that the state of Texas has are the providers in the state of Texas. Those vaccines are intended for Texans, and the expectation is to accomplish that goal.
That's it. Thanks, guys.
I would like to follow up.
Thank you. We're done with the Q&A. I'm sorry.
Excuse me, may I speak?
Sorry. We're done with questions.
May I speak, please? Can I ask a question?
Can you address that briefly?
You said the security?
Yeah, the security as well as
Real quick, listen, the Texas Department, and I'm speaking on behalf of you're talking about Texas-based question or U.S.?
Yes,
Yeah.
sir.
So
Texas, Capitol.
right, and so the Texas Department of Public Safety is very professional, and they deal with challenges like this all the time. And all the time they work in collaboration both with federal officials such as the FBI as well as local law enforcement, and they share information, and they are absolutely on top of any potential threat. They do a great job, and I feel confident that we will make it through the inauguration day without incident in Austin, Texas, or elsewhere around the state of Texas. Thank you all.
Thank you, guys. Thank you.
With respect,
Thank you.
I'd like to follow up my previous question.
I can help you with that.
Well, I need to talk to the doctor, I'm afraid.
Okay. Well, I'm sure the doctor would be happy to talk to you when we're done.
When will that be?
Here, let me get connected with someone over here.
Why don't we, can I ask this question?